Hi, Floppy Catters. Today I have the pleasure of speaking with Dr. Pamela Dragos, who is a highly respected veterinarian with extensive expertise in integrative medicine. She holds certifications in veterinary acupuncture, Chinese herbal medicine, and medical manipulation, bringing a holistic approach to her practice. Her deep understanding of both conventional and alternative therapies makes her a valuable resource for understanding complex conditions like feline hyperesthesia syndrome that we're going to discuss today. Dr. Dragos, thank you for being here.
Thank you for inviting me, Jenny.
You're welcome. As you know, I have a cat that has had hyperesthesia. I don't know if, like, to me, he's in remission, but I don't know how that would be defined medically. Anyway, 3 years ago was a nightmare.
Well, I mean, it can go into remission or it can go away depending on how you treat it. Because when we treat holistically and treat the underlying causes, then we resolve the problem. So it potentially can be resolved in holistic medicine. In conventional medicine, they just use band-aids. They just, treat the symptoms without looking for an underlying cause most of the time.
Yes. Yes. Okay, so let's back up in case somebody new doesn't know what this is. Can you explain what it is in layman's terms?
So, feline hyperesthesia syndrome is a condition where a cat just all of a sudden starts maybe over grooming or twitching the skin of the back or biting itself or jumping and running around and acting strange or acting like they're seeing things, just really bizarre behaviors um, that can lead to more problems, like lead to aggression, like self-directed aggression. And people just are very confused about what their cat is freaking doing.
Yes. Yes. So I'll share what my Charlie was doing. He was, whipping around and mostly focused on that pelvic area.
The base of the tail is a common location.
Yes, licking, biting, scratching. I think he slept for like 15 minutes a day. He was insane. I was insane.
Yeah.
So, what are the common misconceptions about feline hyperesthesia that you've encountered or heard?
Well, we don't conventionally, they don't know what causes it. So the idea is it may be a seizure, it may be a neurological problem and a seizure kind of thing. Um, or it's a behavioral problem like obsessive compulsive disorder. So that those are the things they think it is, um, which is kind of a misconception in itself because holistically there are always underlying causes for those problems, whether they're medical problems or environmental, social, emotional problems.
Yes. Yes. What, from your experience or what you've heard in the veterinary community, what are the most frequently observed triggers or factors for feline hyperesthesia episodes?
Actually, conventional medicine is talking about food allergies and environmental allergies with these guys. So fabulous, because that actually can be a trigger. So conventionally, they're starting to get a clue with that. Um, Holistically, it's a little bit deeper than that because food allergies in and of themselves have an underlying cause. And usually that underlying cause of food allergies is a leaky gut, which is related to diet and toxins in the environment and stress and all kinds of things.
Yes, yes. So my Charlie, uh, for the first 11 years of his life, went to a conventional veterinarian. And then I transferred him at the age of 11 to a more integrative veterinarian. But for those first 11 years, in order for him to be seen, because he goes from Charlie to Chucky at the vet, they required him to have gabapentin because he was just very difficult to manage. So I the first time I gave him gabapentin, I came downstairs. I had two cats at the time, one recently passed. Um, and they were both flat as pancakes on the living room floor. And I was like, I can't do this. Like,
Mm.
this is just mean. Then I told the vet about it, and she's like, okay, give him half the dose the next time. The next time, what I witnessed was very similar to a book that I read about a lady who had had a stroke. She understood everything that was going on, but she couldn't communicate. And
Mm.
so that's what I saw in both of my cat's eyes the second time, that they understood they had the anxiety at the vet still, but they couldn't move their limbs. And I was like, that's just awful.
Right.
So when the option of giving gabapentin was the solution to Charlie's hyperesthesia, I was like, no.
Mhm.
So I was
Yeah.
very, very grateful to have had that experience because then it forced me to look elsewhere.
Right. Yeah. And that's a pretty extreme reaction to gabapentin because, it causes drowsiness, which is what they want for this condition. But yeah, how is that helping the pet? How is that helping the cat deal with the itching? They can't even groom themselves when they're sedated like that. But they also use gabapentin and pregabalin because it has um, anti-anxiety effects. It's used for seizures and it's used for pain. And
Mhm.
one of the theories conventionally is that feline hyperesthesia is a maladaptive pain syndrome, maybe. There's also a thought that it's um, a genetic myositis because they actually did a study where they did skin biopsies in hyperesthesia cats and found these weird inclusion bodies in the cells of the skin that looked like a human condition that was genetic, which was a muscle inflammation. So they're like, is it pain from that?
Huh.
So that's the rationale with gabapentin and pregabalin is it addresses the pain component, the seizure component, and the anxiety component. But we don't have any studies with gabapentin or pregabalin. We don't have any major research studies in cats, and we don't know the safety either. So who knows the long-term effects of that? And our pharmaceuticals are what um, triggers leaky gut. So when we do all these pharmaceuticals, we may be helping put a band-aid on the problem, but we're just destroying the lining of the gut in the process, which is probably more likely an underlying cause of all these other problems.
Yes, yes. Uh, and sorry, I feel like I skipped ahead. So, is it thought to be mostly idiopathic uh, with conventional vets?
Mhm.
And
Yeah,
then would you
because
say
they just don't know. We just don't know the cause of it conventionally.
okay?
These are all
And
just
then
theories.
holistically, would you say it's idiopathic?
Holistically, no, because holistically, like in traditional Chinese medicine, we don't treat a Western diagnosis. We treat a traditional Chinese veterinary medicine pattern diagnosis. And generally, the pattern for feline hyperesthesia is wind damp, and wind is itching, and damp is inflammation. So
Okay.
we're treating a pattern. So we have a diagnosis, and then we pick the right herbs for the particular patient or particular cat based on their history and all their other things going on. And we look at their environment and their every cat is different that has this. I would say, the ones I've seen all have had different variations of things. And the nice thing about holistic medicine, especially the Chinese herbs, is there's not just one formula for seizures. There's like
Mm, mm.
6 or 8 formulas for seizures, and they differ on the pattern of the cat or the pet. So we look at it differently and treat it differently, and that's why we can get a better handle on it with
Yes.
with what we use as far as supplements and herbs. but then we
Yeah.
also have to look at the underlying causes.
Okay.
And we know there's stress involved. I mean, even conventional medicine knows there's stress involved.
Yes. But how do you differentiate feline hyperesthesia from other conditions with similar symptoms like skin allergies, neurological disorders, behavioral issues?
Well, those are all subsets of hyperesthesia.
Okay.
So, so hyperesthesia is a syndrome which includes the neurological problems and the behavioral problems and all the other things.
Right. I guess what I was getting at was, a cat that could just have allergies and it not be hyperesthesia. Or
Mhm.
is that not true?
No, that's true because
Okay.
allergies can present as all kinds of different symptoms. I mean, you could have respiratory allergies or skin allergies. They can get rashes, or they can have the overreaction with the hyperesthesia.
Yes. Okay.
I think it depends on the severity of the allergy and where it is in the body.
Yes. Yes. Okay. And what are the long-term concerns for a cat diagnosed with feline hyperesthesia? I guess it's going to depend on how it's treated, but
Mhm. Well, long-term concerns would be, are they going to be on pharmaceuticals forever? Which conventionally that's kind of the trajectory they go. Um, or is someone going to look at um, have a open mind and look at the underlying issues that are causing this and make the changes that need to be made, or look for things that are causing the problem or the stress or the itching, and that can be complicated, um, and costly when you're doing allergy tests, like food allergy test, environmental allergy tests, checking your house for mycotoxins, um, getting rid of all your toxic things in your home, like the candles and the air fresheners and the laundry detergents and all the stuff that can cause sensitivities, but also cause the leaky gut, where the digestion doesn't work well, and the proteins from the food go through the gut lining and then cause a food sensitivity, which then gets reflected into the skin and causes the hyperesthesia.
yes.
And then you have to think about diet. And most cats are on kibble and canned, and that's a cause of leaky gut. So it's cats are hard because they don't like to change their food, they don't like to take medicine, and they don't like change.
No. No.
So so it's complicated, but it's more complicated because cats are so set in their ways, and you can't really make them do things because then that makes it worse.
Yes. Yes.
So you have to
Yes.
find ways to address all the underlying causes and keep the cat happy at the same time, which is challenging. But that's where homeopathy comes in, because that's relatively easy if you pick the right things.
Yes.
There's really no taste to it, and you can hide it in food, and you only need a little bit, or you do things like essential oils that are topical, or the herb gardens that they roll in. I mean, there are things that we can do to try to treat them, um, with herbs and supplements that don't entail stuffing it down their throat, which they hate. But um, yeah. And then,
Yes.
yeah, and then food is the other thing. And I tell people, with food, that's the foundation. That's the foundation of health. And that's the biggest underlying cause of this, because the poor food, the kibble and the canned and the heat, which is heat processed, causes leaky gut or causes destruction of the lining of the gut, which then causes these other problems. So changing the diet to a fresh food diet is super important, but it may take a year. I mean,
Mm.
literally,
Yeah.
it takes a long time, and you just have to keep trying and keep trying different flavors and different foods till you find one that they might even taste, and just keep giving them a buffet and just keep trying. That's the
Yeah.
thing. You can't just, try a few things and give up because the cat won't eat it. It's so important to change their diet. So my cats, when I was on my journey with holistic medicine, we all fed kibble back in the day because that's what you're taught, and that was the thing. It literally took me a year to get my cats off kibble and canned food. But I just kept trying. I just kept offering. It was always there. And so was the junk. And I just kept giving them less of the junk and more of the good stuff till they finally were like, oh, this is really cool. This tastes better.
Yes. Yes. Well, and step number one with that, and it's a common saying in the cat world, is remove the all day buffet. So if they have dry food down all day, no,
Oh,
change it to
yeah.
specific speeding or feeding times, and then speeding times. And then, they're going to be hungry, so they'll be more inclined. And sometimes you need to go from dry to wet to raw
Sure.
too. You can't skip over
Yeah.
the wet part.
A slow transition. Yeah. Whatever it takes.
Yes. Although I have to say, in my opinion, and it's not anyone, but 17 years of doing this, that even switching to wet is a huge, what is my deal today? Is a huge improvement from kibble. Huge
Yeah,
improvement.
it is. And there are some brands that are not as bad as other brands.
Yeah.
Something like Weruva would be a nice stepping stone. But yeah, ideally we want to do the fresh foods to eliminate the underlying cause. So we treat the underlying cause, or we get started on doing that, with diet and stress reduction, whatever that is for the cat. It could be anything. It could be their social interactions, the other pets in the house, it can be boredom. It can be just too much activity in the house, whatever that stress is for the cat. We need to help them with that as best we can. Um, and
Remove all plug-in air fresheners. I find
yes,
that to be very common a problem.
yeah, the
Yeah.
toxins in the house.
Yeah.
Yeah, because that can trigger all, and that hurts us too. I mean, those are toxins for us too. Those are hormone disruptors. So,
Yes.
which is
But
actually one of the things you have to test for with cats. So you can't like skip over the medical problems. So hormones like thyroid with cats, even with the youngsters, you still want to check that, and you want to check your electrolytes and your CBC and your chemistry panel just to make sure there's not something wrong physically or medically that needs to be corrected, which then if you correct it, then you help stop the problem, stop the hyperesthesia. So you have to look for those medical problems, or even just like fleas, right? Fleas are a medical problem, which can cause itchy skin and even allergies, the flea allergic dermatitis. So you can't skip over your basic medical tests, your skin tests, checking for fleas and parasites, and doing some lab work, some blood work, and check. And
yes.
some vets even will do an x-ray and make sure there's not a pain component from the spine. That would be like a super complete workup, or look medically at the cat to make sure there
Yes.
isn't some cause of pain, in the tail or the spine or something, which
Yes.
I don't think that's terribly common, but it
Yes.
could be a thing.
Yes. One thing that I wanted to mention about the plug-in air fresheners that I don't think a lot of people understand is, if you remove them, that's half the deal, but you still have that residue all over your house. So if you can wash anything, that would be ideal, just to get more of it out of there. But you also need to consider your laundry detergent, which
Mhm.
when before Charlie started getting proper care, in order for Charlie and I both to sleep, he was put on steroids. And I also took him to get red light or laser therapy 3 times a week to reduce the inflammation in his body. These were band-aids that we were doing until I could figure out more. But I needed to stop the flight or fright in my body so that I could process and tackle the situation. So had given him steroids one night, and uh, I don't know why, but I had a new detergent. It was, eco-friendly and all that, but it was gardenia scent. And it came in pods, and it wasn't Tide pods, but the brand had it in pods. And I don't know why, but I had one on the ground, and Charlie just like hit it with his paw. And I was like, "Oh, well, you're a goofball." And like left it at that. And then he went, he just like 20 minutes later was a nut bag. And I was like, "What is going on with you? What's going on with me? I gave you steroids." Like, "No, not
Oh
again."
my gosh.
And I was like, "Oh, it was the laundry detergent."
Mhm.
So got rid of that, washed everything that I knew to wash. And then um he was going crazy again. And I was like, "What did I do wrong? I washed everything." I had forgotten to I should say rewash the pads on my steam mop.
Oh
So
wow.
I'm literally steaming that laundry detergent like residue all over my floors, which he's walking on. So yeah, it can be a crazy puzzle to figure out.
Mhm. Yeah,
Yeah.
it's a tough one. So laundry detergents, I mean, I make my own laundry detergent now.
I think you told me that.
I've
Yes.
come down to that, and they even make little there are devices like magnetic little balls that you can use to wash clothes. You just throw it in with the clothes that apparently hold the dirt off everything without having to use a detergent. So some
Yes.
people that are really sensitive will use those magnetic balls for laundry. But cleaning supplies, you have to get more natural with your cleaning supplies and, use the vinegar and not so many chemicals and fragrances.
Yes. Yes. Yes.
Yeah, and
It's
that takes a lot of work, and some people just don't want to do that because it
right.
is,
There are some people that are so in love with the smell of their laundry detergent that they don't want to do it.
yeah, yeah.
Yeah. Which
And
would I try not to judge other people because I don't have a full understanding of what their lives are, but I didn't I liked my gardenia scent laundry detergent. I liked it a lot, but I like Charlie having a good quality of life and sleeping more. So
well, I found that it was affecting me. All these things when I cleaned up my household, like my
totally.
migraines went away, and like all kinds of different things went away, and I was like, wow, that was really affecting me more than I realized.
Yes. Interesting. I have not noticed any differences for me. What I have noticed is if I go into my mom's house or my sister's house now, I'm like, wow, that soap is fragrant, really
Mhm.
fragrant. And they're like on a scale from like, 1 to 10, I would say they're at a 2 of fragrances in their house. Like neither one of them are big fragrance people. So it's like I'm hypersensitive to fragrance now because it's just not in my house.
Right. Yeah.
Yeah.
And some people will get a headache just from that. I mean, I get a headache
Yes.
from things like that very easily. Um,
Yes.
and then it can also affect your digestion. So you've got toxins in the environment that affect your gut, which then lead to more problems.
Yes.
And then you've got
Okay.
your mold and mycotoxins. You can test for that in your house. Um, that can be a cause of this, not only topically with mold, but also affecting the microbiome when you have a mold toxicity in your house.
Yes. Yeah. Huh. Okay. Get back to the questions I had written down. Um, Given your expertise in complementary and alternative veterinary medicine, what natural approaches do you find that are most effective in managing it? And I guess I was targeting, we've mentioned the environmental things
Yep.
and then food internally, but what else have you had success with?
So I like to use Chinese herbal formulas because they are probably the strongest thing we have um, for the underlying cause, so the leaky gut and the gut problems, but also for the emotional problems and the neurological problems and the like the allergy issues and the itching. So so depending on what the cat's symptoms are, maybe it's um like the itching and twitching with aggression, like with the tail biting. So I would pick something that's going to address the itching and the aggression. And aggression, I usually look at that as more like a neurological thing or even a seizure thing,
Hmm.
because they can just get crazy with the
Yes.
tail biting, and it's horrendous. So
Horrendous.
I have to look at all the issues going on, and I'll choose a formula for seizures because that can be a major component, especially with the aggressive guys. And then
Yeah.
I'll pick a second formula for the allergy component and the itching and the emotional. And with cats, I can usually get it down to two formulas, which isn't too bad. Um, to address all the problems because depending on the formula, they do dozens of different things. So you just have to figure out what exactly they need. Um, so I like to address them with a formula that's going to take care of underlying problems and the superficial problems and start working on rebalancing their body. Um, and then the other things I like to do, you can do more gut stuff, like probiotics, glutamine, um, colostrum, things that are going to help the tummy. So it depends on the cat. I mean, a lot of them aren't going to let you add a lot of stuff to the food, so you have to just see what they'll tolerate.
Yeah.
So the gut stuff is good. And then another thing I like to do is like a gentle liver detox because a lot of this is toxins that are accumulating in the body and causing this reaction in the skin and this itchy feeling, and then also causing the leaky gut. So we want to take care of the toxins that are accumulating in the body, especially the liver, with things like burdock root and licorice and milk thistle. So I have some nice like Western formulas for that have nettle and quercetin for the itching, and then also some nice liver detox herbs to help flush the system out gently and get rid of toxins because yeah, especially with environmental toxins, they're there for a long time. And
Yes.
we can be exposed or the cat can be exposed to like the mold and mycotoxin in the past but still have it in their body. So
Yes.
so it's not until you get it out of the body that you start getting a resolution of the issue.
Yes. Yes. Step number one for Charlie was a detox.
Mhm.
And did we talk about this in the last interview that we did? I don't want to be putting words in your mouth, but I believe you said that sometimes you've got to keep them on the gabapentin or whatever they're on for a short term while you start,
Mhm.
improving their
Oh,
body.
absolutely.
Okay.
Because herbs are not immediate. Herbs are not like a steroid shot. It's not,
Yeah.
they take weeks to months to make changes. So
Yes.
I usually don't pull them off anything conventional if it's helping. But then I start, treating the underlying causes and treating the problem holistically. And when we get to the point where they're doing better, then I start tapering the conventional stuff, the gabapentin and the steroids or whatever they're on.
Yeah.
Yeah, it's not immediate. You can't just take them off gabapentin and throw them on an herbal formula
Yeah.
because you'll be very disappointed and the cat
Yes.
will be miserable. So we need to keep the kitty happy. So
Yes.
don't stop if something's working, but then add in all your holistic strategies. And when the cat gets to a point where they're doing pretty good, then we start making changes with those pharmaceuticals because the pharmaceuticals are fueling the problem that you're trying to fix. So
Yes. Yes. Uh, we talked about the role of nutrition and diet, and then do you have a specific like raw food? I mean, do you have a home cooked recipe that you like or a homemade? I guess it's not cooked.
I have a homemade recipe in my chronic illness guide.
Mm.
And if you go to www.mysickpet.com, I think that's what it is. I'll have to double check. I haven't even looked at that in a while. But I
Um,
have a homemade recipe, but I really like the commercial foods because it's a lot easier.
yeah,
Like
yes.
like All Provide has the raw and the cooked versions of different flavors and different varieties. And then Raised Right has some cat food. And there's some other ones. There's some nice commercial stuff. I mean, if you can do homemade food, fabulous, because then you can do kind of like an elimination diet or a food trial and start with something simple and then start adding things in. But what I find is I kind of skip the food trial and do a food allergy test or a food sensitivity test and like find out what the triggers are and avoid those with whatever diet I choose because of the food trials are hard and balancing a cat food is not the easiest. It's not as easy as the dog food. Um,
Yes.
cats cats are a little bit harder, so you have to be more exact with them.
Do you do a blood test or a saliva test for your food allergy or food sensitivity?
So this, I like them both, but I like the sensitivity one because it is a saliva test. Because most of these cats don't like to go to the vet and don't like their blood drawn, and that's like the limiting factor. Like the cat, that stresses it out, and nobody wants to stress their cat out.
Yeah.
But I do like the Nutriscan, the saliva test, um, and it's a good starting point, to figure
Yes.
out those triggers and avoid them at least initially. And the nice thing is when you treat holistically, those food sensitivities go away over time. So
Yes.
so it's not like they're going to be sensitive all their life to the same thing, or they even may change what they're sensitive to.
Yes. Yep. And I actually found out with my cat that passed that he was sensitive to pork that had been fed corn or soybeans. But if it had
Hmm.
been fed something, more nutritious than that, then he was fine
Oh,
with pork.
isn't
So,
that crazy? That's a tough one now. So
yes.
what they're feeding the animal that then the cat is eating makes a
Yes.
difference. So you need your
Yeah.
grass-fed animals.
Yes.
Yeah.
Uh,
Yeah, that's a tough one. And I mean it's good to eliminate that as a cause if you can.
yes. Are there any specific supplements related to TCM like Happy Wander or Harmonize the Chi that you find beneficial for hyperesthesia cats?
The the common one is the Sanren Tong, which
Mm,
is three seeds, because that's for wind damp, which is
okay.
the most common um, disharmony that we see in these kitty cats. So wind damp, wind is the itching and damp is the inflammation. And then the Sanren Tong or the three seeds combination, I think that's what it's called, helps dispel the wind. So it pushes the wind out and then it helps with the inflammation. So that's kind of a standard formula for these guys, but I find that they need more than just that.
Yes, absolutely. Yes. It's a multi-tiered approach, and I with Charlie, I saw it as removing. Okay, we've accomplished the detox layer. Now we've got to address the leaky gut, and then once that's addressed, I mean, and simultaneously you're working on food sensitivities as well. But
Yep.
yes, it's
Yeah, it's
not.
complicated. You
It
know,
is.
if we knew the exact cause, then we could treat it. But um, we know that it's lifestyle.
Yes.
Lifestyle
Yes.
factors that lead to chronic disease. So, diet and stress.
Yes. What I don't want to do though is discourage somebody that is on gabapentin and is like, ugh, it's going to be that much work. I'm already exhausted. I already have caregiver fatigue. But the difference is that yes, it's you're going to increase your workload, but then it's going to go like this and it'll be smooth sailing. Like
Exactly.
my life with Charlie now, I would have never dreamed of 3 years ago. I would have thought he'd
Yeah.
be dead by now.
Yeah.
So yeah, it's a lot more work, but in the beginning, but then the rewards are far better.
Absolutely. And you'll benefit too.
Yes.
And the other thing with us is our issues get reflected in our pets. So cats are really sensitive to our issues. So our emotional issues, our stress, and they feed off of us. Uh,
Yes.
and energetically, I find that um, pets, especially cats are really sensitive. They feel like they need to help us. So whoever they're bonded to, they feel like they need to help them and pull their issues from the person into them. So they're pulling
Yes.
your stress into themselves to help you out.
Yes. Yes.
So energetically, we need to take care of ourselves too, which will then take care of the kitty cat's problem.
Yes. Yeah, and so in this group on Facebook that I'm a part of, I mean, honestly, all the people and all the caregivers in there, they need massages and
Mhm.
therapy and just as much as the
Yeah.
cat. I
We
mean,
need to
they're
take
a
care of
disaster.
ourselves.
Yes,
Yeah,
yes,
absolutely. So don't forget yourself. Yeah, we
yes,
absolutely do. And that's part of the treatment for the cat with hyperesthesia is to take care of yourself.
yes. Which
Absolutely.
is really hard when they're attacking their body all day long. It's really hard.
Yep. Yep.
Um,
And you have to give yourself some grace and, realize it's a journey and, keep a log or a diary on the cat so you can figure things out and see patterns and just do the best you can.
yes. This question, man, I'm thinking of a couple different ways that you could go with this, but what are the limitations of natural therapies in managing hyperesthesia, and when would you recommend a more conventional pharmaceutical approach?
So conventional pharmaceutical is for acute or immediate control. So if we've got a cat that's biting their tail off and, self traumatizing themselves and they're a wreck, I reach for the pharmaceuticals first. We need to get that under control because if we don't, then it just, you know, it causes more problems. So I look at the pharmaceuticals as your first line approach to take care of the immediate issues. And then
Okay.
and then you start with your lifestyle factors and your herbs and supplements and your detox, and get that on board so you can rebalance their body.
Okay. And so how do you monitor a cat's progress? Like how do you know that they're improving when you start these therapies?
It's well, there's really not a blood test for it. So it's just on what a pet parent would see. So
Clinically.
the
Yes.
twitching, itching, biting, hallucinating, whatever they're doing, we just look at how they're acting and how comfortable they are and because cats will tell you, I mean, behavioral issues, stress related behavioral issues is common, but it's not just stress. There's an underlying problem, and cats are really good at telling us that there's something wrong. And this is just another way that they're telling us something is wrong. So we just need to look at them and see how, and kind of check in and see how they're doing. And that's how we know it's getting better.
Yes. Yeah. One of I the veterinarian that I go to, she is also an acupuncturist and does Chinese herbs and stuff like that. So, as you know from having that ability as well or knowledge, you can just feel on the pet how they're different. So I had started the detox protocol and all that stuff. I was working with a holistic practitioner that guided me for Charlie, who was not my vet. And my vet, put her hands on him and she's like, wow, he's really different and he's a lot calmer. Like, what have you been doing? So I think, if your vet is intuitive enough and has the training like you guys, then they can pick up on it as well. But
Absolutely. So we do tongue diagnosis and look at the tongue, the color and texture and size um and we look at and we feel the pulse and do pulse diagnosis to see where the disharmony is or not. And then we feel the body, we feel the acupuncture points, and see if there's changes in temperature or texture of those and see which ones are active. And that's how we can physically tell if something has changed.
right. Okay, so let's say I have all these questions, that I laid out of things I wanted to talk about, but I feel like we've already addressed some of them. So I'm thinking now that I want to ask you, um, how if I go to a conventional vet and we're on gabapentin 3 times a day, and you know, these are the stories that I hear in the feline hyperesthesia group that my cat's on 100 milligrams of gabapentin. My vet's telling me to put him on 200 milligrams 3 times a day. I mean, that's why I wanted to have this talk with you, is because I wanted people to understand that an a conventionally trained vet who also has a background now in more holistic integrative approaches, like there is a way out of the nightmare of just throwing more drugs at it. But what do I do? I've trusted my vet for years. Can I work with you, telemedicine wise, but then is that going to piss off my vet? How do you
Well, it's
handle it?
it's always good to have a team, especially with a chronic issue like this. You want to put a team of professionals together. So you have a general vet, you maybe have a specialist to consult with, like a neurologist. You have your holistic vet. You might have people that help, like with pet sitting or grooming. Like you want to put this team together. And most vets understand that it takes a village to help with chronic disease. One vet can't do it all. And that's why a lot of the general practitioners will refer you other places. I mean, they have their limits on what they know because there's so much to know in veterinary medicine. No one can do it all.
Right, right.
And most vets will understand that.
Yes. Yes. Okay. Um, so to reach out to you, I just go to your website and then there are prompts there to schedule a
Yeah.
consultation.
Yeah, I
Okay.
have consults on drpameladragos.com
Okay.
to order a consult and fine tune what you're doing with your cat so you can resolve this. So
Yes.
I'll look at the history and what you're doing and maybe what you've done with your vet and what they've seen and done and see if there's something that I think has been missed. And a lot of times it might be like a food allergy test. Um, and then figure out a rational plan. Um, I think you remember Tofu, the
Yes.
hyperesthesia cat. That pet parent was amazing. She had Tofu like on 15 supplements and 3 pharmaceuticals. And I was like, how on earth are you doing this? I don't know how you're giving this to this cat. So I actually had her just scale back because when you give a lot of things, it dilutes out what you're giving. So you want to really
Yes.
be careful and give, what will give you the most bang for your buck. So I help people either figure out what they can give to their cat that will work for that personality and how to give it, whether it's liquid or powder or topical or whatever. And then I also help people that are giving a lot of stuff kind of scale back and be like, okay, let's just focus on this and see what kind of response we get. Because a lot of the supplements and drugs will cause side effects that you don't realize.
Yes. Yes.
Even itching is a side effect of some of them. And you're like,
Yeah.
oh, awesome.
Yes. I am a excellent supplement giver as well, and Tofu's mom and I are good friends now because we met in the hyperesthesia group and then realized that we were kind of the same in I'm gonna win, you're not going to win. I will get this supplement in you. But I've certainly found like nicer ways to give it. I one of the things that because he's got kidney disease and so he gets supplements every day anyway now, except for the day after he gets fluids. And what I do is I open up a can of sardines that's in spring water and I pour out the water into a little ramekin. And then I take one of the sardines and put it in that ramekin so that that water stays really fishy. And then I give him the other ones. And then I use that water for the entire week. I might add more spring water to it. So I will syringe that up and then mix that with whatever he's being given. Chinese herbs are a tough one. If they come in a tablet, awesome, because then you can break it up into like force and then it's not it's not as repulsive for them to taste, but the powders are really tough, and so I'll stick them in a empty gel capsule, um, so
Yeah,
that
you
he
have to
doesn't have to
just
taste it.
Yeah, you have to do all the tricks based on what your cat will tolerate.
Yeah.
Some of the herbs come in tea pills, which I actually like for
Yes.
cats because they don't have a lot of taste and they're like little round BBs and they go down
Yes.
easy, or you can hide them in treats. You can even cut them in half or quarters and put them in a treat and they don't even seem to mind.
Yes. I like tea pills as well. Yeah. Um, so another reason that I wanted to talk to you is because in this group, I see people, the cat is mutilating their tail. And that is when I understand an e-collar because like there are bloody pictures and that's like uh um so you don't want the mutilation, but it's when they're putting an e-collar on a cat that's just itching, biting, scratching like Charlie was, that I think if I had an itch and you didn't let me itch it, I would go insane. Like you would just cause more stress. So I
Mhm.
wanted in both scenarios, the one that's mutilating the tail and the one that's just itching, biting, and scratching that has an e-collar on, I wanted them to know that there are ways to improve health, restore health.
Absolutely. Because
Yeah.
yeah, with the e-collars especially, that's just another stress component for a cat.
Yes.
So, and stress is an underlying cause of this. So we want to break that stress cycle as best we can. And most cats, if they're just itching and licking, they don't need an Elizabethan collar. It's just it's not helping and it's actually hurting. For the ones that are attacking their tail, I had a patient Oreo that had the aggression and would bite his tail, but they were doing the collar and they were putting him in a kennel. And I was like, just stop doing that and see what happens. And he didn't bite his tail off and he didn't rip his tail up. I mean, he just like, it's a predatory behavior that's gone awry. And he was like, oh, I'm going to attack my tail. But he wasn't doing a lot of damage. And sometimes you just have to test the waters and and see. I mean, people worry about the bloody tails and all that, but let's do some other things to mitigate that stress, like your anti-anxiety herbs. So like valerian and chamomile and just calming things, um, and try to help them not be so horrible with their tail and not have to resort to the e-collar and confining them, which then starts that cycle again. So that cat
Yes.
actually, Oreo, um, he actually went to the mother's house and has cat friends and is still on his herbs and is doing so much better just from changing environments and having more freedom and more friends. So, and that has done wonders for him, where it was just frustrating for the daughter, and she would do the e-collar and confine him, and you could see the frustration in her, and that was affecting the cat too. So
Yes.
so we have to look at everything and not just rely on pharmaceuticals and e-collars, because
Yes.
that won't take care of it. It
Yes.
won't.
Right. Yes. Agreed. Yeah. I look back at my journey. So, and something I forgot to mention earlier, that is I met you or found out about you through Tofu's mom. And I was like, I mean, she's an incredible researcher. She just, I
Yeah.
mean, super sleuth. So she was the one that told me about you, and I was like, gosh, I wish I would have had someone like Dragos when I first like had this problem. Because I mean, I went to chiropractors. We still go to a chiropractor, but I went to 5 different chiropractors because nobody could handle Chucky until I found one that could. Um, and to this day, I mean, she's like, I can't believe how much this cat has changed. It's really remarkable. And I spent thousands on x-rays and all this stuff, and it would have been really, really beneficial to have someone like you to tackle it.
Yeah, because conventionally they don't look at the emotional component as much. And if they do, they're using like amitriptyline and clomipramine. They're using the OCD and the anti-anxiety drugs.
Yes.
Yeah,
Thank
where
you for, yes, that's another thing that I wanted to mention is when I was talking about, like, I know that this sounds like a lot at first, but to me, when I was reading through the post on the hyperesthesia group, these people are pilling their cats 3 times a day. I'm like, I'm not gonna have a life. I'm not gonna be able to go anywhere. Am I gonna have to call a cat sitter if I want to go to like a show at night? Like, this is awful. Like, I was so depressed thinking about how, like, my quality of life as well, because if my quality of life is poor, then I can't offer a good human to my cat. So that, I think that's also why this is hugely beneficial, is like I got my
yeah,
life back.
yep,
Yeah.
absolutely. And because there are ways to do things holistically that um that go with your lifestyle well, and even with herbs. I mean, you don't necessarily have to give herbal formulas 2 and 3 times a day. It would be great if you could, but a lot of these cats, I'll just do the whole daily dose once a day. Done. You know,
Done.
yep, there are just ways to approach it that aren't so strict like the pharmaceuticals are.
Yes. Yeah. I really, I wish I could give all the people listening that have a cat with hyperesthesia the relief that I have now. Because I remember, wanting to find a talk like this, wanting to,
Yeah.
just have that relief and know that it could get better. And one of the reasons that I reference Charlie so much is that this happened right before he turned 13, and he's almost 16.
And
So,
that's kind of unusual to happen at 13 because usually it's a younger cat issue.
oh, and I see, I was gonna ask, I had that question written down, but I was like, oh, I see it all over the board,
Yeah.
on the
And
hyperesthesia group.
conventionally they see it in the younger cats. And I'm like, I mean, maybe it's um they're more prone to stress or something because they're more active. Who knows? Um, but to have it happen later in life is kind of interesting. So, was he developing kidney problems at the same time?
Um, I don't think so. His No, it's only been the last 2 years, and
Okay.
it's his creatinine, but that's the only level that's high.
Okay.
So he the gal that helped me, her name is Pam as well. Um, and she said that it was the rabies vaccine that caused his kind of ignited his
Yeah.
inflammation and stuff. So then it makes me wonder if it's the young cats, is it because they get so many vaccines from the
Could
get-go.
be. Could be. So maybe on a poor diet, get a bunch of vaccines, get a flea and tick treatment, and then you're off to the races. You know,
Yes.
you've got leaky gut and you've got then all those other problems from the initial all those initial toxins. And vaccines, I mean, there's a place for vaccines, but we need to do them rationally. And the rabies vaccine in particular is a neurological vaccine. So if your pet has a neurological problem, then you don't need to be doing that anymore because it will worsen a twitchy cat.
Yes. Yes. Well, and the other thing is find a veterinarian that will support, like my veterinarian, for example, was like, no more vaccines for Charlie. And I was like, oh, really? And she's like, definitely not. Because of, his hyperesthesia. And I was like, oh, cool, thanks.
Mhm.
Um, but that can
Absolutely.
be problematic when you're trying to get chiropractor, you know, appointments at a different vet because they
Right.
want all those rabies vaccines and stuff like that. But then I had Dr. Sally is her name. She was like, I'll just write a letter, and luckily they've accepted it.
Yeah. A vaccine exemption. Yeah.
Yes,
Because vaccines can induce um, inflammatory issues. That's what they do. They
yes,
cause inflammation. And especially rabies causes nerve inflammation and brain
yeah,
inflammation. So,
yes.
yeah, you have
Well,
to be
and Charlie
careful.
does have, that's something that we haven't really talked about. He has a feline allergy dermatitis. And so at the age of 6, I started giving him Revolution. So he got
Mhm.
all that crap too.
Yeah, which
Yeah.
doesn't help. So
No.
that's one of the
But
causes, underlying causes.
yes, yes, he got it all. It was like, here you go. And I hope you can survive. So I've
Yep.
I've learned all the opposite, and thanks to people like you that are educating. So thank you.
You're welcome. I'm glad to help.
Yeah.
These
All right.
these
So
hyperesthesia kitties need a lot of help on all
yes,
different levels.
yes. I will include a link to your website where people can find you. And then I'm also going to try to find the mysickpet.com link that you mentioned earlier. So
Yeah.
that's
I don't know if
handy in
it's
the description.
your sick pet or my sick pet. I don't know. Uh,
Okay. Well, I'll find it so that people don't have to, so it's just an easy click for them in the description.
it's your sick pet. Here it is. Yoursickpet.com.
Okay.
And it
Is there
has a
anything that,
recipe for kitty cats.
okay, the home cook or homemade
Mhm.
raw.
Yep.
Yes. Um, is there anything that I didn't ask that you wanted to mention?
Um, let's see. I think we talked about everything. Um, maybe enrichment. So the stress component is important. So some cats just want to be left alone, which fine. They want to just look out the window. Some cats need more activity. And what I find is the over grooming behavior is just grooming gone awry, and the attacking themselves is the predatory behavior going awry. So distraction, like when they're biting themselves, I'll do another thing that they can pounce on. So, like with the feather toys or whatever they like to pounce on. So distract them with something that represents what they're actually doing. If they're attacking their tail, then let them attack something else.
Oh,
So distraction is good. And grooming, I don't necessarily distract them from grooming because that's a soothing behavior for a cat. When cats are stressed out, they groom themselves. So you have to just find out what the cat needs to relieve that stress so they don't have to groom themselves too much and too vigorously.
yes,
And
yes,
but yeah, giving them enrichment or more things to do or outside time or looking at birds or whatever it is that they need, we have to think about that, and it is all very individual.
yes, yes.
So those are just some things that I think we didn't touch on.
Yeah, you're right. More on the behavioral side that I didn't
Yeah.
think of. Because, yeah, these cats are cooped up inside all day and they're not really meant to be like that. And
Right.
so, yeah, if you can
And like,
catify your home, even better.
right. And then, when people are like, I'm just going to euthanize my cat, I'm like, don't. Before you do that, let him outside. Let him take his chances before you freaking euthanize him. And when people do that, the cat gets better because they're like happy. I'm like, "God," they're outside with the nature and the fresh air and the birds, and they're able to do little, their normal kitty instinctual behaviors. And all of a sudden the problem goes away. And you're like, oh, wow, it was my house.
Yes, yes. And in that case, then yes, you really wonder, like, is it mold? Is it the,
Yeah.
fragrance toxins? What is it in my
Or
house?
is it just stress of being cooped up? Because when they're
Mm,
immobile, that causes liver qi stagnation, which then causes wind in the body, which is the itching and the biting.
got it.
Yeah, so
Yeah.
we don't need to give up on these guys.
Yes.
There are
Yeah.
always alternatives.
Um, that's amazing. And while you're talking, I'm like, this is exactly why I wouldn't want to be a vet because there's so many possibilities. So many.
Yeah,
My
you have to be a medical detective to figure out some of these things, and that's what I do. I look at the situation and try to figure out what the cat is thinking and why they're doing it and how to fix it.
Yes, but I mean, the questions that you would need to ask in order to discover that. I have a cousin who's a veterinarian in Colorado Springs, and she went from a brick and mortar to visiting pets in their homes. And I was like, "What? How's that different?" Like, and she's like, "Now I can see that's why the dog is doing that because
Yeah,
you like." And I'm like, "Oh,
yeah,
yeah." So
yeah.
yes,
Cats are very sensitive to their environment, extremely.
yeah.
So
Hmm.
you have to just sit back and watch and try to figure it out from the cat's perspective.
Yes, yes. Well, amazing that you do what you do. So thank you.
You're welcome, Jenny. Thank you.
And thank you for being here again. I
My
will also
pleasure.
link our other interviews. We did one about kittens last time.
Yep,
So that was fun.
new kitties. Yeah.
Yes. And how's Mr. Nash?
Oh my gosh. So my new puppy Nash is huge. He's doing fabulous. And I actually adopted his sister because, interestingly enough, Nash was itching. And I'm like, what the heck is going on? And I couldn't figure it out. And it was stress from being away from his sister. Because when I would have his sister over, he wouldn't scratch. And when he'd have play dates with her, he wouldn't scratch. And I was like, I think it's stress from being away from his sister. And so that was one of the reasons we were like, let's just adopt the sister too. Plus there were other reasons. She's just darling. Her name is Darla. And so now I have two, but no
Oh,
itching and no stress.
okay, good. And they're happy playing all the
Yes,
time, I'm sure.
yes. They're
Oh,
very happy.
Darla and Nash. My third grade teacher's name is Darla. I love that name because she was awesome. Thank you, thank you, thank you.
You're welcome, Jenny. I'll talk to you
Bye.
again.
Okay, bye.